Commissioner, Mission Director, NRHM, friends, distinguished guests, ladies and gentlemen. India is growing fast in technology application. One of the major areas where it has really made a remarkable impact is the use of telemedicine technology for augmenting, for enriching the quality of medical care and health education in this country. Telemedicine Society of India is a non-profit making academic body working towards population of the technology and for wider application of telemedicine both in health sector and medical education. Today, I'll be talking on the telemedicine activities happening in the state of Odisha, because Odisha happens to be one of the leading states in telemedicine technology application. We have the major chunk of this population staying in the remote areas, and this technology can make a difference in optimal utilization of the available medical resources. The second area, possibly one of also the leading areas in telemedicine technology application, is education. We have been using this in most states of this country. As you know, this country has more than 500 telemedicine nodes established by the Ministry of Communication and Infrastructure Technology, Government of India, the Ministry, that means the Department of Space, and also the state governments, through interactive virtual classrooms, through conferencing and through telementoring and teleproctoring. And finally, possibly we are entering to the age where we will be using more often this technology for telepresence or presentation. As I said, this picture shows that you have an export on the left side at Sanjay Gandhi Post-Grad Institute of Medical Sciences, because the medical college hospitals of the state of Odisha are connected to Sanjay Gandhi Post-Grad Institute of Medical Sciences, and the government of India in fact has identified 6 regional telemedicine resource centers. One is PJ Chandigarh, second is AIIMS New Delhi, third is Sanjay Gandhi Post-Grad Institute Lucknow. Then you have KM Hospital Bombay, then we have one at Pondicherry, and final one at Nigrim Shillong. So these are the 6 regional telemedicine resource centers, and the states are linked to this regional telemedicine resource centers. We have been using regularly this for obtaining second opinion in situations where there is really a difficulty for the expert in making a diagnosis or planning the management. Then the follow-up. For thyroid cancer, we have the operating facility in the state, but the second part of the treatment of a patient thyroid cancer is radioiodine therapy, and this facility is still today unavailable in the state of Odisha, and patients after treatment are referred to Sanjay Gandhi Post-Grad Institute for radioiodine therapy. And these patients, when they are declared disease-free, receive the same facility as they would have got if they had gone there for follow-up, for getting follow-up advice. So this he was using regularly. We have more than 300 patients of thyroid cancer who are on regular follow-up at SC Medical College, Cuttack. So this is how every Wednesday, first and third Wednesday, we hold this clinic at Cuttack, and we have the teleconferencing facility. We use the teleconferencing facility or video conference facility for seeking advice of the remote expert. Then remote treatment planning. Sometimes you have patients who are critically ill. They come to district headquarters hospitals where they fail to plan the treatment, and in those situations they take the help of the experts of Cuttack Medical College or Burla Medical College, Berhampur, to plan the treatment for patients who cannot be transferred right away from the district headquarters hospital to medical college. Otherwise they will succumb on the way. So this is a patient the patient was attacked by a wild bear, and both the windpipe, food pipe were exposed at this. They kept on advising him, the remote expert at Koraput District Headquarters Hospital, how best to manage this patient with the facilities available there, and the patient was saved. without being transferred to medical college hospital. So this is extremely essential, particularly in emergency situations. Pre-referral screening. Many patients who are referred either from district headquarters hospital to medical college hospitals or from medical college hospitals to super specialty hospitals in Delhi or in Lucknow or in Chandigarh. And it is essential that all these patients before referral should be screened so that you know which are the patients really need to refer and which patients do not. Because many patients from district headquarters hospital are straight away referred. The moment they reach the district headquarters, they refer to the medical college hospitals. So that unnecessarily increase the load on the medical college hospitals. The best way is as is happening in Punjab. In Punjab, unless a patient has pre-referral screening, he cannot be admitted to medical college hospital. That is a rule they have made in Punjab. So similarly, that it should be this such rule should be there in every state. The patients, unless they have prior screening, should not be referred to medical college hospitals because many patients who otherwise can be treated there with regular advice getting from the experts of medical colleges through video conference. Then the other area I told you, education. So these are the regular classes of post-grad students at medical colleges being held, and where experts or the professors of the Sanjay Gandhi Post-Grad Institute or at times also of Foreign Institute of Medical Sciences or PH Chandigarh, they take classes for students. Now which are the areas? There are many areas where do not have competent teachers but do not have study material available. There are some new departments which are not yet, we have not started this department in the colleges and practice in district headquarters hospitals. They think that possibly they are out from mainstream. But by having regular sessions with them, they do not feel they are away from medical colleges and they developments and their experiences. These are the medical classes, distant medical education classes being held in medical colleges and the experts in the super specialty hospitals at Lucknow and Delhi taking classes. Skill promotion workshops, sometimes operative surgery workshops. Many times, as you know, doctors need updating in recent surgical procedures. Then they have to go to city-based hospitals or go to super specialty hospitals to attend workshop to know what are the new technologies in different or techniques in operative techniques. But if you have the telemedicine facility and a high bandwidth as we have now, we have now NKN, National Knowledge Network, has provided a 100 Mbps bandwidth to all medical colleges, 3 medical colleges of Odisha, and even also to the private medical like the KIMS and to some medical college. So they have also got high speed bandwidth. So we have got 100 Mbps bandwidth and we are using it for transmitter of the operative procedure right from the medical, from the operation theatre of the super specialty hospital to our colleagues or our faculty members. So I think possibly we are in a time where we do not need every time to go to a conference or workshop to see what is happening. We can stay here and interact with them and see the procedure if you have high bandwidth, which you have now. So this is what is known as telementoring. Telementoring in fact is real-time interactive teaching of operative techniques by an expert of surgeon to a student not at the same site. So this is telementoring and we are using this technology for telementoring. A number of conferences which are held in different places are being transmitted live to the medical college hospitals where the faculty members here or participants here do interact live through two-way audio and two-way video. Where as I was telling that we are possibly entering areas where we can use robots for robotic arms. Actually, our robotic medical robots are not the robots which you see in physics. We use robotic arms for performing different surgical procedures. There are a number of robotic equipments available now in many hospitals of this country. However, we have not used this for tele-robotic surgery, but maybe soon this country will use this for tele-robotic surgery. So maybe in the surgery in future will be no longer about blood and tissue, rather it will be about bits and bytes. And a little bit about the telemedicine activities that is happening in Odisha. The Odisha Telemedicine Network was established in 3 phases. In phase 1, that was in 2003, when the 3 government medical colleges of the state were connected to Sanjay Gandhi Post-Grad Institute of Medical Sciences, Lucknow. That was 2003. And then looking into the outcome of the where regional diagnostic centers came up because CT scan and ultrasound machines were installed in those regional diagnostic centers and where we didn't have experts. So we thought and so on and so forth. So and how this state has been benefited by this use of telemedicine technology. Now this benefit has been to the patients and to the students and to the teachers. Benefit to patients. So around 3 the pathologist or the radiologist wanted second opinion. So this has been used for reaching at a diagnosis in difficult clinical situations, planning the management protocol of critically ill patients. And then second opinion, sometimes pathologist seeks second opinion for a pathological slide where he fails to make a conclusive diagnosis, and then comment on CT MRI film, particularly the difficult patients. So these are situations where the patients have benefited. Then benefit students. So students have been benefited, as I told you, that in certain areas where we have like departments, rheumatology department came up recently only at Cuttack, but there are many places, Bulla, Parampur do not have department of rheumatology. So these are certain areas like rheumatology, genetics, nuclear medicine. So these facilities are non-existent in the state, and we take the help of the students. By interaction in these areas, they get benefit. So more than around 200 teacher topics have been discussed between the students and the experts of the medical colleges or remote hospitals, particularly the super specialty hospitals. So they get the advantage of getting access to not only the teachers of that particular medical college, but also nationally reputed teachers. Benefits to teachers, medical professionals, that helps, as I told you, the upgradation of the professional knowledge and also the technical skill. Now recently government of Odisha is taking the telemedicine to the reach of common man through the public-private partnership, which you will listen later. And so to conclude, I would like to say that telemedicine offers easy, cheap, fast, at any time and from anywhere contact between the medical staff and the patients. Accepted well, it may cause significant reduction of the part of the healthcare budgets. It is not a replacement but a complement to the face-to-face examination. So that we are emphasizing that to everybody, if you say that your telemedicine cannot replace the face-to-face examination, never say it is a replacement. It is always a supplement, a complement to the existing traditional face-to-face examination system, which is there and which will continue to remain there. Then the single most important principle of medical care is to provide satisfaction to the patients. And if the patients get satisfied, so for example, as I was telling that follow-up, now every time the patient has to go for follow-up every 6 months to Sanjay Gandhi, it will not only cost him money but also loss of time. Now if the patient sees the expert who treated him at Lucknow through video conference, then that gives a satisfaction. That is what is required in medical science. The patient must get satisfied by he looks at the surgeon or physician who treated him, he describes to him, and then that is he gets solace from him. That gives him satisfaction. That is essential in medicine, and that we provide through video conference. So friends, I think this is all about the telemedicine activities happening in the state, and as I told you that this has really made a difference in promoting, it has proved to be a useful tool in not only promoting the quality of healthcare but also medical education in the country as well as in the state. Thank you.
Have any question for us? You can ask.
MBBS, and from medical college side you were having 2 MBBS upload back to speed.
Any other question? Yes.
So what kind of software should we use for this kind of and second question is if you have to establish this kind of a setup in a medical college, how much does it cost?
First is the software. We are using actually 2 or 3 softwares. So one is Televital. Then we have also involved CDAC Pune to implement our telemedicine project where we are using Mohanty software. Sometime back also we have used Sanjeevani and eSanjeevani, that was which are developed by CDAC Mohali. So these are all the softwares we are using for telemedicine activities. Now as regard the cost, you are saying that the cost varies from 4 lakhs to 18 lakhs. So depends what are the equipments you need, either in a medical college setup or a district per setup or a rural center. So depends, are you going to develop and use a economic model, are you using a full phase all equipments, scanner, everything. So depends on all these things. So the range varies from 4 lakhs to 18 lakhs.